Hey guys, I wanted to send you a quick video this week on really what's happening in our healthcare system when it comes to the use of medication, the overuse of medication. Right now in North America, we make up 5% of the world's population. We take upwards of 75% of the world's drugs. Listen, I don't care if you believe in drugs. I don't believe if you're a doctor, a medical doctor, surgeon, nurse, chiropractor, a homeopath. I don't care in what camp you're at. 5% taking 75% of the world's drugs. It's not adding up. It's not making sense. So we take the most of the world's drugs, but we do not rank the healthiest country in the world. We actually rank 37th out of 37th of the industrialized countries when it comes to the performance of our healthcare model. So we take the most drugs, we have the most surgeries, we spend the most amount of money, trillions of dollars per year, okay? And watch this, we have the best doctors, we have the best surgeons, the best hospitals, the best research facilities, we have the best colleges when it comes to the medical system. But okay, so we have the best people and the best education, and we have apparently the best drugs, the best technology, the most money invested. We should have an outcome of health. And the problem is this, we're not. We're not having an outcome of health. We are going down a path of sickness, symptoms, and disease. We're going into crisis care to try to get well. A patient told me this last week saying, he's starting to I always say kind of like the veil is being opened up to where you start to question one thing in the healthcare model, you start to question everything. And so he just started realizing that he's like, it's crazy, Dr. Nick, that when I was sick and I wanted to gain health, I went to a place where sickness was. I went to the hospital, or I went to urgent care. I was trying to get healthy and well by going to a hospital. I mean, it's insane. It's a place of sickness, crisis, life-saving care. Don't get me wrong, they're great at that, but we shouldn't go to crisis care to get to the answers of what caused it and get to the answers of how to get healthy, right? And just a quick example of that is what we're doing with aspirin. I mean, come on. I have patients that come in and think they're healthy, and they say, you know what? Yeah, watch this. I just take a baby aspirin. How long have you been taking the baby aspirin, Mr. Smith? Oh, my doctor told me to start 20 years ago. I mean, okay, so that's a chemical, and this is the thing, is that the baby aspirin is being prescribed to try to thin the blood so there's no strokes, clots, hemorrhages, heart attacks, you name it, right? And the concern I have with this is this, it's chronic toxicity to the body. Do you know what else can thin the blood and accomplish the same goals and sometimes even better? It's just a few things, okay? Maybe you're doing these, maybe you're not. But ginger can actually thin the blood and help with reduce any blood clots. Also garlic, kind of important. Fish oils or omegas, omega-3s, we have those in the office, right? And water, staying hydrated, and then dark leafy greens like kale, and we use Max Greens and other things like that can help thin the blood naturally. So why aren't people being taught that hey, here's the top 5 list of things that actually thin your blood naturally without toxic chemicals? Why aren't people given that list, and why are they being given a baby aspirin, which is just crap? Because I'm going to read some side effects of baby aspirin, just so you guys know. Some people who are more susceptible to complications from aspirins involve this. People who have heart failure, people who've had heart attacks, people who have past strokes, asthma, allergies, stomach ulcers, bleeding or clotting disorders, diabetes, right? Now, here's some 6 aspirin side effects. Make sure you hear me on this, okay? Kidney failure, liver failure, ulcers, tinnitus, which means ringing in the ears, hemorrhagic stroke, and Ray's syndrome, which actually it damages our organs. And so you start to look and see, okay, I can either do something more natural that the doctor's not going to tell me, or I can say, I'm just not going to do anything natural. I'm going to take a baby aspirin for the rest of my life. I don't care if you believe in what I say or don't say. I mean, if you think that's okay, like that's a problem. You know what that does? It gives people a freedom or a reason or an excuse to not to even try to be well, but they're just going to pop this pill and say, hey, it's going to help my heart attack, it's going to help my heart disease, it's going to help my stroke. It's crazy. The youngest cardiologists that are out there right now, the new ones, 30s, 40s that are out in the profession now, aren't doing it anymore. So it's an old practice that's now being pushed off to the side because more and more doctors are now saying, more and more cardiologists are now saying that aspirin is unnecessary and actually can hurt you over time. So let's wake up and say, you know what am I currently doing with my health? Am I relying on a pill to gain the health that I want? Or am I relying on my action steps and my lifestyle to change the outcome of my health down the road? Remember, guys, getting healthy is simple. It's just not easy. It really isn't. And my goal and my mission is to make it as easy as possible for you. So guys, have a blessed day. I hope this really blessed one of you guys out there. Take it, put it in action, and just rock and roll. Let's get healthy.